Hello and welcome to the webinar. My name is Katie Mercier and I'm the Communications Associate at the Coalition for Juvenile Justice. This is the Juvenile Justice Reform and the Pew Charitable Trusts webinar. I wanted to just walk through a few technical details before we get started. First, you'll notice that all the participants are in listen-only mode, which means that your phones are muted. We'll do questions and answers at the end, but if you have a question throughout the presentation, you can type it into the questions box. Or during the Q&A, you can click the raise your hand feature, and then I can announce you, unmute you, and you can ask your question. I do suggest that if you are on a cell phone that you use the questions box so that we can avoid any audio feedback issues. This webinar is being recorded, and the recording of the webinar and the PowerPoint will be posted on CJJ's website within 24 hours. And with that, I'd like to introduce our speakers. Sonia Hallam is a Senior Associate with the Pew Charitable Trusts. She is a part of the Juvenile State Policy Team and assisted in providing technical assistance to Georgia and Kentucky in their juvenile justice reform efforts. Prior to joining Pew, she worked as a nonpartisan legislative staff member in the Washington State House of Representatives and is a licensed attorney with over 10 years of experience in juvenile justice and child welfare litigation. Robin Olson is a manager for the Public Safety Performance Project of the Pew Charitable Trust. She currently manages the project's Juvenile Justice State Policy Technical Assistance, overseeing work in South Dakota, West Virginia, Kentucky, and Hawaii. During her more than 3 years on the project, she has provided technical assistance to state leaders in Georgia, Missouri, South Dakota, and Mississippi, resulting in comprehensive sentencing and corrections reform legislation in each state. Prior to joining Pew, she worked on criminal justice issues as an analyst and advisor for the District of Columbia and the state of Illinois. And with that, I'd like to turn the presentation over to our presenters.
Great. Thank you so much, Katie. We're happy to be here with you today to share information about the Pew Charitable Trust Public Safety Performance Project. What we've prepared here is an introduction to who we are and how we work. And I'm going to go through about 20 slides. Sonia and I will go through about 20 slides here. And I just wanted to say a couple things up front. The presentation is not designed to be long, so there should be plenty of time at the end for questions. And as you have, we've kind of intended this to be an introductory kind of overview of the work that we do. If there are other items of interest that you'd like to hear about, feel free to raise them when you ask questions. My email address will be the last slide of the PowerPoint. Feel free to email me. And also feel free to give some feedback about other pieces of information that you'd like us to share at another time. So with that, we'll go to the next slide. First, a very general overview of who we are. The Pew Charitable Trust focuses on providing rigorous analytical information and assistance to improve public policy. As one of the many projects supported by the Trust, the Public Safety Performance Project, where Sonia and I works directly with states and provides data-driven, fiscally sound policies and practices in both the criminal and juvenile justice systems. You can go to the next slide. More specifically, our charge at the Public Safety Performance Project is to work with states to examine their juvenile justice systems. As states have seen declines in commitment over the past 15 years or so, we know that they're looking to lock in or accelerate the decline in commitments, as well as improve outcomes measured in terms of recidivism as well as positive youth outcomes. And that's what we're really focused on, is helping states get a better return on their juvenile justice spending. With our assistance, states are focused on protecting public safety by improving outcomes for youth, families, and the public, holding juvenile offenders accountable, and controlling juvenile justice costs. We've been working in adult sentencing corrections since about 2007 and on juvenile justice reform since 2012. We've now worked or are currently working in 5 states. We've worked with Georgia, Kentucky, and Hawaii, and we're currently assisting South Dakota and West Virginia on their reviews and reforms this year. You can go to the next slide. Today I'm going to talk about the technical assistance that Pew provides, as well as highlight some of the key information that's part of our assistance. First, I'm going to explain 4 steps of our technical assistance process. And so starting in the spring of each year, we select 2 states to partner with. We're invited to provide assistance by the state's governor, legislative leaders, and chief justice. We help facilitate a working group or task force process over the course of about 6 months through the summer and fall. This culminates in a report back to state leaders. Usually that report includes recommendations for legislative, administrative, or budgetary changes, and then we transition into providing some legislative assistance to educate lawmakers about the policies that are part of the consensus report. Lastly, we work for the state for about 18 months after bill passage on the first phase of implementation, and I'm going to walk through each of these 4 steps in more detail in the following slides. So you want to go to the next slide. So first I'll talk a little bit more about state selection. So we use an informal process for selecting states to partner with. There is no formal application process, and there's no specific requirements the state consider this type of reform or that type of reform. Instead, we require that state leaders from all branches formally invite us in to provide support through a bipartisan consensus-based process. For example, on this slide here, you'll see these are an excerpt of some of the goals that West Virginia, who are assisting this year, established for their task force. Each state selects their own goals and focus which are aligned with our project's expertise. And in West Virginia's case here, they're focused on a comprehensive review that's going to improve outcomes, enhance accountability, and contain costs. In terms of how we start working with the state, it starts with informal conversations at conferences or calls where interested stakeholders, government officials, or others talk with us about their priorities, and we see if there's a match in terms of what their priorities are and what some of our expertise is. We're looking to work with states that want to take a hard, data-driven look at how they're spending their most expensive out-of-home resources and examine if they could be getting a better recidivism and other outcome return with the resources they're putting into their juvenile justice system. We can go on to the next slide. I next wanted to talk a little bit about the task force or the working group or the commission. States, when they work with us, we typically engage with a group, and it can be ad hoc or a formally established commission, a standing commission that involves a lot of different stakeholders from all 3 branches, as well as people throughout the juvenile justice system and other child-serving agencies and entities. The task force we've worked with are interbranch and bipartisan. Typically, as you can see here, there's strong representation from the governor's office, juvenile justice, child and family agencies. The judicial branch has folks from, all the way from the Chief Justice and AOC Director to judges and probation officials. Legislators from both chambers and parties are on the group, and then many stakeholders from education, law enforcement, local government, and there really isn't any exclusionary criteria here. I think it depends on the nature of the juvenile justice system in each state and where the different stakeholders are most engaged. We facilitate a consensus-based process. All input is valued and considered. And we can go on to the next slide. I'm going to talk a little bit more about the task force facilitation. So you'll see here I have 3 steps listed out. As I mentioned earlier, we start in the springtime with the task force kind of convened. Through the first several months, we engage with the state to look at the state's own data. We have a team of folks who we dedicate to working in the state and become kind of ad hoc data analysis folks to work with the state's own agencies to either look at data that they have collected in different ways, summarize it, synthesize it, put it together, work with the state in making sure that the information that the state's already collecting, as well as trying to collect some additional data, gets presented to these stakeholders so they really can consider what's happening with their system. We also take a look at, it says here, system assessment. We try to make sure that everyone at the table understands the flow of youth through the system, what the different components are, all the different agencies and people who are responsible for making the system work. Next, in the fall, we spend a lot of time helping just to facilitate policy discussions. Many times the task force members will break down into subgroups focused on different policy areas that they're looking to tackle, and we'll help prepare information and background research for those groups to consider. Later, you'll see we focus on making sure the groups have data and research and state examples available to them, and this is where we'll try to gather information about what's happening across the country that these task forces might want to know more about, so they can see which of their issues they're trying to tackle might be addressed by some of the policies other states have already successfully implemented. And then third on here, I have consensus building. You know, it's really a pleasure to work with these task forces because they've got so many different perspectives at the table. And so a big part of the work is going through all the different policies that have come up through the subgroup process or through conversations and help the group work toward which ones the task force as a whole wants to move forward with in terms of a package that's going to meet the goals that they've laid out at the beginning. All throughout the process, there's extensive stakeholder engagement, you know, kind of inside the task force process through formal presentations, as well as meetings with task force members or with our staff to make sure all the information is coming back to the task force as they're considering policies. The task force often hears a lot of presentations or information from experts in the field, both from in-state experts as well as from other states. And I wanted to note, too, that while you'll see later that the states we've worked with that do address policies in similar kind of general policy areas, we don't have a model policy or model legislation or model package. It really is based on, you know, what data and findings the task force is discovering, bringing the research and state examples to them, and helping them just work through what they think their priorities are in terms of the reforms they want to put forward in the report. So I'll go, speaking of the report, I'll go to the next slide. So the work of the task force is usually summarized in a report from the group to state leaders. It contains usually some context and background, key findings, as well as the recommendations. As one of our task force chairs for Kentucky noted here, going through the task force process and obtaining input from experts and stakeholders from throughout the state creates a momentum and credibility that really assists the legislative and implementation process. So, you know, the task force really does take a good 6 to 8 months typically, and the report is usually not terribly long. It's actionable. It's about the recommendations. But it should summarize a lot of the thinking that the task force went through over that period of time. You can go on to the next slide. I next wanted to talk about our next stage of our technical assistance work, which is legislative assistance. We stay involved through the legislative process, supporting the champions who are working to pass the recommendations from the working group or task force reports. In the 3 states where we've worked through the legislative session, the task force bills have passed with wide bipartisan margins, often with reinvestment and upfront investment associated with them. For example, in Hawaii, House Bill 2490 passed this past session with a unanimous vote, and $1.26 million in upfront spending to support the reforms. Also, aligned with this wide support that we see in the vote counts there, we've recently engaged in some national polling that we hope to release soon. And what we found there is public opinion is really aligned with what you see here, these wide margins. Voters believe that juveniles are fundamentally different than adults and want policymakers to invest in programs that help prevent youth from reoffending. Voters support diverting lower-level juvenile offenders from correctional facilities and investing the savings into probation and other alternatives. And we see that that support is strong across all political parties, regions, age, gender, racial, ethnic groups, and the like. So, for example, one of the questions we asked is, when voters were asked what's more important to them personally, 75% of voters agreed with this statement that getting juvenile offenders the treatment, counseling, and supervision they need to make it less likely that they will reoffend, even if they spend no time in a juvenile correction facility, is something that they agreed with. Whereas 20% agreed with the statement that making sure juvenile offenders receive a serious punishment is their priority, including being sent to a juvenile corrections facility. So you'll see here there's a lot of wide support for finding other alternatives that are going to get good outcomes on recidivism and other outcomes for youth, which is what these packages generally include. Also of note, after passage, Pew works with states on early implementation support, and I wanted to specifically highlight some new resources that are made available this year through the Office of Juvenile Justice and Delinquency Prevention. They've released a solicitation for about $600,000 in technical assistance for support to the 3 states that have engaged in comprehensive reforms thus far, and CRJ's Crime and Justice Institute will be providing this help over the next several months, just getting started with that. But that's good news that implementation is important. These reforms generally are very comprehensive, and the implementation process is really critical. We can go on to the next slide. So next, I just wanted to highlight 3 particular types of information that we really want to make sure we're providing to the states as part of our technical assistance. I'm going to talk about data analysis, research, and information about what other states have done. I'm going to give a few examples of each of these over the next few slides, and it's really just to give you an insight and hopefully some ideas of how we're engaging in the states. You can go on to the next slide. So data analysis. From the start of our engagement with the state, the focus on data and objective information is really critical. The goal of the data analysis work is to determine which youth make up the juvenile justice and corrections populations and examine outcomes and cost drivers. We also seek to provide an overview of policies, programs, statutes, system flow, as well as an overall evaluation of how the system is performing. So just to give you an example of what this looks like, you can see on this slide that when we worked in Georgia, the data analysis found that there were low-level youth in out-of-home placements. 45% of youth in non-secure residential beds were misdemeanants and 8% were status. The group also was interested in the way the system was handling some of their felony youth as well. The group found that between 2002 and 2011, designated felon length of stay increased about 13%. The group looked at outcomes. They found 65% of youth released from their YDCs recidivated within 3 years, and they looked at costs. Their secure bed costs were running about $90,000 per year per bed. In each state we've worked with, we look at similar dimensions. Hawaii and Kentucky also examined their systems, and in Hawaii, they found nearly 2/3 of their secure facility new offense admissions were for misdemeanants or status offenses. They had a very large increase in length of stay over the past decade. A study from the previous few years had found a 75% re-adjudication or reconviction rate within 3 years, and also very high costs in their secure facility. In Kentucky, they found misdemeanants and violators were a majority in each of their different placement types. More than 80% of their placed youth had 2 or fewer prior adjudications. They found length of stay was up across their offense types, felonies, misdemeanors, and violators, and up the most for violators and misdemeanants. And more than half of their over $100 million DJJ budget was spent on out-of-home placement. So that just gives you an idea of some data that we work with with the states to bring to the task force and the commission work. I'm going to the next slide. So I wanted to just put a couple quotes up here from Judge Jones, who was on the task force in Kentucky, and Director Hipp, who was on the working group in Hawaii. You can see, while task force members really know their system very well, the data analysis sometimes reveals some important findings or just put some numbers to what folks already know. You can see here Judge Jones says it's surprised to learn some of the facts about our population because you want to think you're just committing the bad kids, and in fact we really weren't. And David Hipp here said, when I started to look at the types of kids we had at the correctional facility, I realized the overwhelming majority of them were not at risk to public safety. So we can go on to the next slide. In addition to data analysis in terms of who's coming into a juvenile justice system, how long they're staying, and what the outcomes are, we also strive to bring the best of the currently available research in the field to the task forces we support. For example, we bring information and studies about residential placements, that they generally fail to produce better outcomes than alternative sanctions. They generally cost more and can actually increase reoffending for certain youth. We also talk quite a bit about community programming and practices and the importance of evidence-based tools, risk and need and placement decisions, and the value of treatment and quality service delivery. Many states find that their systems are not aligned with the research principles of what works. Next, Sonia is going to talk some about the information around policies and state examples. Pew also brings information in the group about what other states have done, and state examples span all 50 states, and we really strive to bring the best that's out there to the task force. We try to bring in speakers who have pioneered successful policies in other states, such as Ohio's Reclaim or Judge Timberlake and Betsy Clark with Redeploy Illinois. In general, the state examples fall into 3 categories that the states make policy recommendations in, and to give you a sense of the types of examples we typically share, Sonia is going to outline the policies that the 3 states we've worked in have recommended. So with that, Sonia, can I turn it over to you and we can go on to the next slide?
Yes, thanks. So based on the data and research that Robin just referenced, the task force develops policies which are the basis for the legislation that it later proposes. So each state is different in terms of the data and the issues in the state. As Robin just mentioned, the majority of the policies can really be divided into just a few main categories. One of these categories of policies focuses the use of out-of-home facilities on higher-level offenders. Georgia, Hawaii, and Kentucky have all adopted different policies because their issues are different from one another in their states, but all have chosen to utilize the state's most expensive placements for higher-risk youth, a practice that is very supported by the research. In Georgia, they have a group of youth that they've statutorily defined as the most serious juvenile offenders, and they categorize them as what they call designated felons. Over the years, this group has expanded and now captures what are actually some very lower-level felony offenses, such as what they call a smash-and-grab burglary. The task force decided to divide the designated felonies into 2 different classes based on the seriousness of the offenses, and they've reduced the penalties for the less serious of the offenses. They've also eliminated the mandatory minimum confinement periods and reduced the maximum out-of-home placement for those less serious felonies. In addition to the changes to the designated felons, Georgia also prohibited out-of-home placement for status offenders and certain misdemeanor offenses. In Georgia now, a juvenile can't be committed on a misdemeanor offense unless they have 4 prior adjudications, one of which must have been a felony. In Kentucky, the state also chose to restrict out-of-home placement of lower-level offenders by prohibiting commitment of certain misdemeanor offenses, and they also are prohibiting commitment of some Class B felony offenses. They are limiting the amount of time that youth can be committed to DJHA and how long those youth that are committed, how long they can be placed out of home. They have also revised their policy on supervision violations to require graduated sanctions, and they have limited the out-of-home placement for sanctions for violations of supervision to a maximum of 30 days. Previously, a youth who violated their terms of supervision could be revoked and committed to the DJJ facility and placed out of home for an indefinite period of time. In addition to addressing youth who were at the deep end of their system with these policies, Kentucky chose to address a number of lower-level offenders that were entering their juvenile system altogether by creating an enhanced pre-court diversion process that provides assessments, case management, and connections to services for youth and their families. Like both Georgia and Kentucky, Hawaii focused their resources on higher risk offenders by adopting policies to prohibit the out-of-home placement of misdemeanor offenders into the secure facilities. Unlike Kentucky and Georgia that allow some misdemeanor offenders to be committed, Hawaii prohibited the commitment of all misdemeanor offenders into their secure facilities. So as you can see, though the states were similar in the overarching policy of focusing their resources on the higher risk offenders, they did so in different ways because of the issues in each state. Next slide, please. A second area where states have all, the states we've worked in, Kentucky, Georgia, and Hawaii, have all adopted policies involves increasing community-based options that serve as alternatives to residential placement. In Georgia, they created a fiscal incentive program, which is a competitive grant program targeting those counties that were committing the most youth to the state's secure facilities. The state invested $5 million in a new appropriation and added $1 million of existing federal funds for a total of $6 million. This amount provided evidence-based programs throughout the state in 49 different counties and served approximately 70% of the youth that they were determined to be in their at-risk population. The program required a reduction in commitments to their state facilities, and the state really hoped that in the first year, because the program was just getting up and running, that they would see a 15% reduction in commitments to the state facilities. Instead, almost all of the counties in the program reduced their commitments by far more than anyone had ever expected. The state has continued to fund the program at the same level, and this past year they added $1.6 million in new funding for DJJ, their Department of Juvenile Justice, to provide evidence-based programs in those counties that did not receive the initial grants. And then there is additional funding to provide second evidence-based programs in some of those original counties that received the competitive grants. So the total current funding for the fiscal incentive program in Georgia is over $8 million for the fiscal year 15. And in addition to this fiscal incentive program, Georgia also required the use of evidence-based programs and risk assessments, and they had revised their supervision system to allow youth to be put on administrative caseloads. In Kentucky, the state also recognized the need for increased services in the community. Like Georgia, they created a fiscal incentive program. However, rather than providing an upfront appropriation, they created a funding stream that dedicates savings that are achieved from the reduction in out-of-home placements to the DJJ facility. They dedicated a portion of this savings into the fiscal incentive program and to the DJJ programs and practices in the community. Kentucky also required the use of evidence-based programs and practices in their juvenile justice services as well. In Hawaii, like Georgia and Kentucky, the state required the use of validated risk and needs assessment, as well as case planning and sanctions and incentive system. They also did something that Georgia and Kentucky had not, which was to modify their supervision practices to allow youth to earn early discharge from probation. Next slide, please. The final major grouping where states have all adopted policies is to enhance the oversight of the juvenile justice system and to institute measures that ensure the programs and policies that the state adopts are performing as they're expected in order to achieve the outcomes that are desired by the state. All 3 states created an oversight council to monitor the implementation of the reforms and review the outcome measures that were put into place. All 3 states also improved data collection and reporting in order to better track outcomes of their programs and practices. And in the case of Kentucky, they weren't actually able to track recidivism rates, so they required data collection and reporting in order to know the recidivism rates of the juveniles in their system. And in Georgia, they also required performance-based contracting for DJJ services. And in Kentucky, they increased training and education for juvenile justice professionals. And now I'll turn it back over to Robin. Next slide.
Great, thanks, Sonia. I just wanted to end, I've just got about 3 more slides to show here, and I wanted to end and talk about what the anticipated results are in the states that we've worked with. So looking out over the first 5 years of implementation in Georgia, they're expecting their population to be reduced by about 1/3, savings in the range of about $85 million. In Hawaii, they're expecting a state population decline up to about 60%, savings of about $11 million over that time. In Kentucky, population reduced by about 1/3 and savings up to $24 million over that time. And I have a quote here from Judge Browning, who is really integral to the work in Hawaii, saying the most important change is ensuring that judges only send a kid to our secure facility if he's a threat to the public, period. So I just put that on there to say it's really a change and a transformation in a lot of these states in terms of how they're thinking about the resources they're putting into their juvenile justice system and really refocusing it on alternative evidence-based practices, risk and needs assessment, case planning, and the like. And in fact, Georgia, that's had the longest to implement so far, the latest numbers that I had seen is that the state has actually seen a 62% drop in commitments to the Department of Juvenile Justice year to date over the first 9 months of this year. And their facility population is also already down about 14% compared to the same period last year. So already starting to show some results there. Next slide. As we wrap up, I wanted to encourage folks on the call to think about the program or the problem or issue that your state might want to address in the area of juvenile justice, and think about the timing for state leaders to address that issue. There's a lot of great resources in the field to work on juvenile justice, and there's particular pieces that we think we can be helpful with states. I think there's a lot of other resources out there as well, and I think what I really like engaging in a conversation is about, with folks who know their system really well, what's a priority, what's important, and how can we share lessons learned across other states so they can be brought to bear with the issues that you're looking at in your state. And to the degree that we can be helpful in that process, we would love to be. So with that, we can go to the next slide, which is just my contact information, and wanted to turn it back over to CJJ, take any questions. And as I mentioned at the top, we've got several publications and research efforts ongoing, including that national polling work, recidivism research, and the like. Please just email me at my email address there to get onto our newsletters and listservs, and if you have any particular requests for information, just don't hesitate to call or email. So with that, I'll stop talking. Thank you.
Okay, thanks, Robin and Sonia. So like I said, you can enter your question into the questions box by typing it, or you can click the raise your hand button and we can unmute you. Again, if you missed my earlier comments, if you're on a cell phone, we really encourage people to type in their question to avoid any audio feedback issues. And while people are doing that, I just wanted to remind everyone that this webinar was recorded, and the webinar itself and the PowerPoint will be posted on CJJ's website. So our first question for our presenters is, how long does this process take?
Sure, I'll take that one. This is Robin. So we start informally talking with states anytime they're interested in talking to us, and typically there's several months of kind of sharing information back and forth about priorities and interests. We start to have more serious conversations about the nature of our technical assistance and how we can help folks, usually around January or February of a calendar year. Then we start working with the state, usually April, May, and June of that year. We try to help those task forces have reports done by that first calendar year. So you're looking at a year-long process already there. And then we do stay around through the legislative sessions. So that would take you through, another half a year there, and so we're at 18 months, and we are committed to staying around and helping with some of the early implementation over the next year and a half. So that's just an outline there, but it can be a whole 3-year kind of time period with more intensive interaction with us kind of over a 1-year period from kind of a summer time period through the end of the legislative session.
Okay, our next question is, when doing a data analysis and research, are the PREA standards compliance and implementation looked at to help states plan for that as well?
That's a great question, and one that because of our timing so far, we haven't addressed head-on. So I guess I would say yes, to the degree that the state we're working with wants us to look at that. We really do see ourselves as kind of being staff to the state for that, especially that intensive time period for the year, and want to make sure that our resources are available to help them look at their most important questions. We are focused on helping states figure out, where youth are flowing into their system, where resources are being spent, and where some alternative and policies that could be put in place to get better outcomes, particularly recidivism and other positive youth outcomes, out of the way the system is structured. So that's the framework. The degree to which looking at important issues related to PREA compliance go into that, I think would definitely be on the table, and it would just depend on each state in terms of how we could be helpful with that.
Okay, our next question is, can you be more specific about how Kentucky is funneling more money into community-based services?
Sure. Sonia, do you want to talk about this one?
Yeah, so Kentucky, as I mentioned earlier, they didn't make an upfront appropriation. So what they're doing, and it's I think a great example of increasing collaboration between agencies. When we first went into Kentucky, there was a lot of division, and what I think probably you see in many states, silos, so to speak, between the different agencies and their resources. One of the great outcomes of the reform process in Kentucky was groups that came together with the agencies, Administrative Office of the Courts, Department of Juvenile Justice, and their child welfare agency. They have a regular meeting now where they talk about resources that they can combine together to provide services for youth. And obviously providing services in the community is critical to the functioning of both child welfare and juvenile justice. So what they are doing is, even though they didn't create a new funding stream, they are working together to ensure that particularly mental health and substance abuse treatment are more easily accessed by youth and their families in the state. And they're doing this in a couple of different ways. One of the things, I'm not sure where they're at, but they talked about the lack of training for evidence-based providers, and they were talking about collaborating between their behavioral health system and DJJ, where DJJ actually would provide the funding for training of these providers, and then they would be Medicaid eligible and be able to bill through behavioral health. So there's their system of care, essentially is what it is, being enhanced and providing priority access to juvenile justice involved youth. That's one way. They also had, unrelated to this, a pharmaceutical settlement where they increased substance abuse treatment. I think it was $17 million of substance abuse treatment that was going to be available, and a significant portion of that was dedicated just to youth to be able to provide substance abuse treatment, which in Kentucky, in the previous year, there were only 216 youth that received outpatient substance abuse treatment through their substance abuse, behavioral health substance abuse treatment system in the entire state. So this is a dramatic change in access for substance abuse treatment. And finally, through the bill itself, the fiscal incentive program, though it doesn't have an upfront appropriation, as I mentioned, as the Department of Juvenile Justice reduces their population of youth that are committed to their facility, their cost goes down. The amount that their costs go down depends on some of the policy changes they make. That's why, as in the slide that Robin addressed, the state could potentially save up to $24 million over the course of 5 years. And this that portion of savings in the bill is dedicated to 3 areas: 25% to the Fiscal Incentive Program, 25% into day treatment programs, and the remaining 50% back into the Department of Juvenile Justice to enhance their supervision and community-based services, so that the youth who are probated or supervised by DJJ in the community will have enhanced services as well. So those are the 3 main ways that they're increasing services to youth in the community.
Okay, our next question is, you mentioned that states can make a proposal to the Pew Trust, but how does the state begin to talk with your office, and what is the protocol for the proposal?
Sure. First, you see my email address up there. Anyone in a state, and we've been contacted from, government officials, agency folks, legislators, providers in the community, advocates. Really, it's a completely no wrong door place. So anyone can email me. It's probably the best way to get started and express some interest in kicking off a set of conversations. And what happens is our team will contact you, get familiar with some of the issues that you feel like is happening in the state, get recommendations of other folks to talk to, and we'd like for that to kind of evolve over several months. So it's not a, this week we have to do this and next week you have to fill out this form kind of thing. It's really an informal process over the course of several months to get a feel for the priorities the different stakeholders in the state have. Basically, as those conversations evolve, it does get a bit more formal until we get to a point of feeling like the state is ready to formally invite us in to provide technical assistance. Before we start providing work, we do need a letter from the state signed by state leaders inviting us in to give that assistance. And I guess I would just add, we usually are working with states and asking for those more formal letters around the March and April time periods of each calendar year.
Our next question is, did Pew measure stakeholder engagement throughout this process? And if so, what sort of outcomes did you use to measure engagement?
What we've done in states, probably, and then we focus on performance measures, we could get better at this, but it's really more of a input count. So we keep track of how many different people we talk to, how many different meetings, how many different times. So we want to make sure that we're reaching out to just as many people who want to be involved as possible. So I think that's just the first basis is, are we in a quantity way making sure that we're reaching out to the people who know about the system, that the task force is benefiting from their stakeholder points of view. And then I would say another measure would be direct information going to the as you can see, our process is really based around these task forces, and so a lot of our measurement would be how much information came back in front of that task force in the forms of reports from roundtables, in the form of presentations from stakeholders, in the form of submitted remarks or information for the task force to consider. So I think we could get better at kind of an official performance measure there, but really we're looking at quantity and making sure that the task force really has direct access to that information.
This is Sonia. I just want to add that every state is just so different because of the process that they use. Some states use subgroups to gather information. Some have very public information type meetings where stakeholders are actually allowed to speak to the task force. So it really varies. In Kentucky, the chair met with every stakeholder individually who had anything that they wanted to say, in addition to being able to have access to the full task force. So it varies so widely that it would be difficult to really quantify the different ways that people access information. And the one slide that Robin showed where the arrows are going up and down, that really, it's important to emphasize that it goes on throughout the process, and it doesn't end once the bill is created, because the process of gathering stakeholder input even, I think, in many ways gains momentum once the bill is introduced, and many changes are made afterwards when people can see what the language is, and then they have other comments. So the stakeholder engagement continues throughout the process and really is in every state a little bit different.
Our next question is all technical assistance provided at no cost, including speakers, staff visits, etc.?
Yes, actually, there's no cost to the state at all. Our board here at the Pew Charitable Trust has funded our project, and when we go into a state, we do not require any monetary contribution from the state. There's quite a bit of time that folks in the state have to spend as members of the task force or as members of agencies who are providing data to that task force and the like. So there's definitely a commitment of time and passion to the effort, but Pew does not charge anything. We send typically about 3 or 4 staff to work with each state. And yes, we do foot the bill for bringing in speakers and presenters to try to get that information in front of these task force and working groups.
Next question is, are there any opportunities for nonprofit organizations to be a part of your task force, specifically a nonprofit that utilizes law-related education to work with vulnerable youth?
Yes, absolutely. In terms of how the task force and commissions and working groups are put together, I mean, we kind of going to be an annoying thing to say. It always depends on the state. We think of that as a strength here, that it's always designed to match how a state operates. What that means, though, is those working groups are kind of formed in different ways. So in some states, we've worked with standing commissions, whose members are like statutorily already required. So in that case, unless a nonprofit, there's a seat for a nonprofit, they wouldn't be on it. In some states, it's a completely ad hoc working group that state leaders put together. And so the process there would be, you know, in that lead up of informal conversations about, you know, a state engaging this type of reform, making sure that the folks putting the working group together knows about the important nonprofit or other organizations that really should have a seat at the table and being named to that. So we definitely are working with states that have similar organizations like that on the task force, but we have also worked with states where they haven't been because it's been a more formal standing commission type of makeup.
And I'll also add, for those groups where they're not formally on the task force, that doesn't mean that they're not very heavily involved. For example, in Kentucky, the Kentucky Youth Advocates, I would have to say, were a very, very important stakeholder in this group and provided a tremendous amount of information and support to the task force and the legislators throughout the entire process. They just weren't formally a part of the task force, but they were very involved.
Okay, our next question is, have you worked closely with law enforcement in any of the states?
Yes. I'm trying to think back in terms of the membership in all of our states. I think the task force members, sorry.
In Georgia, let me tell, if you don't mind jumping, in Georgia, there was a sheriff who was on the task force, and of course we always have a prosecutor, but I think that was the only, at least in Kentucky, there was not a law enforcement officer specifically on the task force, just in Georgia, but they definitely were consulted, as were the jailers and part of the stakeholder group. I don't know about the current makeup in West Virginia.
Yep, I can speak to that. So in the other states, we do have police chiefs or sheriffs on the working group and task forces. So they typically, I guess from that little sample right there, typically they are formally involved. There is a representative of a police chief or sheriff on the task force, and I would say, you know, in all states they are being engaged as a very important stakeholder throughout the process.
Our next question is, have you picked the states you'll be working with next year?
No, we haven't. So we're currently in the working group process with West Virginia and South Dakota right now, and we're just starting to have some conversations with states who might be interested in working with us starting in April of 2015. So we have not picked our states for next year. We are starting to talk to some states who have some interest, and hope to have some further conversations with folks over the next 4 or 5 months.
Okay, the next question is, what have been some of the biggest challenges you have found in working with these states?
Good question. So there's 2 types of challenges that I think I'd want to speak to. One is that there are so many potential things to analyze and tackle and look at. So when we talk with folks in that lead up to offering technical assistance, there's really the scope of what a group might like to work on can be really large, and it's really exciting to work on this and to work with motivated folks who want to take a hard look at this and come up with some transformative policies. And it's difficult to kind of draw a line and say, no, let's cut the scope here or there. So I think it's one of the challenges is just limiting the scope of what the group can feasibly tackle in the time frame that we're helping with. And then I would also say that juvenile justice systems sometimes struggle with having robust data systems. And so the groups in the task force, and we're very motivated to bring the best of the data that we can to those groups for decision making. And that's a challenge. I mean, it's, there hasn't, in some states, there hasn't been a lot of extra money recently to invest in really robust data collection systems. And so trying to get the most data to inform this process can definitely be a challenge.
And I think I would add that,
sorry, go ahead.
To add to that, the challenges I think that probably most of the listeners would expect that you would have in states. When you try to engage in significant reforms, there are just pushback from certain stakeholder groups. And I think that's why the project that we are involved with has been very successful, because we bring together these diverse stakeholder groups and work together to develop a consensus. So the pushback that you get from the traditional stakeholders is significantly lessened. But in some of the states, there's been just tremendous pushback in certain areas, and that's been a challenge for the task force in trying to develop recommendations, because they are consensus-based. It's not a majority, it's a consensus. And I think that's a challenge to develop really meaningful, comprehensive reforms through a consensus-driven process.
The next question is, would it be too late to work with Pew in 2015, and how quickly would we need to contact you?
So I would say it is too late for the full technical assistance process, because we do, what I've just outlined here, it takes several months to kind of look at all the data and engage stakeholders and that sort of thing. But I would say contact me and let me know what you would like help with. What I've described today is our 90% of the time how we interact with states, but it's not 100% of the time. We do offer assistance and research and information in other ways. And we do know that every juvenile justice system is very different than another, and the model that I've described today of how we work with states is going to work for some states, but it's just not the way it would make sense to engage in others. And so if you have something urgent or something interesting you'd like to send to me for this upcoming legislative session, let me know, and if we can be helpful, we would love to be.
But it's not too late for the to start in 2015 because, as Robin mentioned, the process really starts in, the task force process starts in May or June. So if there's an interest in working for the 2016 session, now is really the time to contact Pew in order to be able to engage in reforms for the 2016 session.
Okay, the next question is, has there been any work done in the DC or surrounding areas, or any discussions with those areas that you can speak of?
We had the pleasure of having some folks from the Virginia Department of Juvenile Justice come to a convening that we put together over the summer. So we've been able to meet a lot of those folks. We try to talk with folks in every state, so I would say Virginia, Maryland, DC is definitely on that list, and we like to know, what folks' priority are and, what we can be helpful with. So I'd say there's always an open door and some level of conversations ongoing, but we haven't done a full technical assistance engagement with any location touching on the district at this point.
Okay, I think we have time for one last question, which is, how does the fiscal incentive program work, and does it help to get more services in the community?
So I talked about the fiscal incentive program in terms of what Georgia has created. I think Ohio is probably the most well-known fiscal incentive program, and of course Illinois' program as well. What they all really have in common is that the goal is to increase services in the community, and they do this by reducing the population of youth that are placed in the more expensive out-of-home facilities. As you can see from the cost, I think that Robin had mentioned, these facilities, secure out-of-home facilities, are costing $80,000 to $100,000 per bed per year for a youth. And if that money is allocated to services in the community, it can just provide so much more through community-based services than for one youth in a residential facility. So by reducing the population in these out-of-home facilities, if that money is then reinvested into community-based programs, that is how they increase services in the community. So normally with the fiscal incentive programs, they're generally a competitive program, and they require use of evidence-based programs and a targeted reduction in commitments to these out-of-home facilities. Different states do it a little bit differently in terms of who they're targeting and how wide the scope is, whether the money can only be used for youth that are committed to the facilities versus also allowing some prevention type programs or diversion programs, but they all will focus on those youth that are committed into the deep end of the system. Once the population is reduced, then that money can be reinvested into services in the community. And normally there is a requirement for the measurement and data to be given so that they can show that they're meeting these outcomes. And that's basically how a fiscal incentive program will work.
I think that's all the time that we have. If we didn't get to your question, as you can see, Robin's contact information is up on the screen. Just a reminder, this PowerPoint and the recording of the webinar will be posted on CJJ's website within 24 hours. And with that, I'd like to thank our presenters for doing an excellent webinar, and everyone else have a great day.